Atherosclerosis is a disease in which fatty material is deposited on the wall of an artery. Normally, the walls of an artery are smooth, allowing blood to flow unimpeded. However, if damage occurs to its inner lining, fat, cholesterol, platelets, and other substances may accumulate at a damaged section of the arterial wall. Eventually, the tissue builds up and a plaque is formed, narrowing the lumen of the artery. Where the narrowing is severe, there is a risk that the vessel can become blocked completely if a thrombus forms in the diseased segment.
Percutaneous coronary intervention, also known as coronary angioplasty, opens narrowed coronary arteries. A small, hollow tube called a catheter is inserted into an artery in the groin or arm and threaded to the affected artery. A thin, flexible metal wire is then advanced through this tube and past the site of blockage in the artery. A second, smaller catheter is then inserted over the wire and threaded to the same artery. When it reaches the narrowed area, a small balloon on its tip is inflated to reopen the artery and flatten the blockage into the artery wall, while at the same time stretching the artery open to increase blood flow to the heart. Both catheters and the wire are then withdrawn. About 70 to 90% of coronary angioplasty includes placement of a stent, a wire mesh tube that holds open weakened arteries. The stent may prevent re-narrowing after an artery is widened, and it stays in place permanently as the blood vessel lining heals over it.
All the arteries in our body consist of three layers, three distinct layers. The outermost of these layers is called the adventitia, a fibrous layer that holds the vessel together. Inside of the adventitia is the media. The media is a muscular layer that allows the vessel to open and close on demand. As you require more blood flow to your calves while you walk, the vessel can open up and supply that necessary blood flow. Inside of that is the intima, one cell-thick layer that protects the entire vessel. Because of our diets and our smoking, we can end up with trauma to that intimal layer, which the body tries to heal, and that provides a fatty streak, which you can actually see in relatively young age. It begins right after childhood. Repeated injuries, you get an atheroma or a plaque, which narrows the vessel and prevents it from opening and closing normally. If that gets bad enough, you can actually clot off the vessel and form a thrombus and completely block the main blood flow to whatever end organ it is. If that's the head, you'll end up with a stroke. If it's the coronary arteries, you'll end up with a heart attack. Hopefully the first presentation is blocking the vessels to the legs, and you end up with claudication or pain when you walk, to clue in your physicians and yourself that there's a problem with your vessels that we need to go in and fix.
This animation will show how atherosclerosis develops in the heart. Click the navigation arrows below the animation screen to play, pause, rewind, or fast forward the animation. Atherosclerosis is the process by which arteries become gradually narrowed and hardened. If this happens in the arteries that supply the heart, it causes coronary heart disease. This can lead to chest pain called angina, and eventually a heart attack. The network of blood vessels that branch over the surface of the heart are called the coronary arteries. Atherosclerosis can happen in any part of the coronary arteries. The coronary arteries supply the heart with blood. Over years, fatty deposits in the blood can build up and form a plaque or atheroma on the artery wall. This can prevent the heart muscle from getting the blood and the oxygen supply that it needs. This tends to happen during physical exertion or when angry or stressed. It causes a heavy or tight chest pain called angina. Afterwards, the pain goes away. If the plaque continues to grow, the risk of having a heart attack, where the blood supply to the heart is completely cut off, rises. This is the end of the animation.